All right. Well, thank you all for joining us today. My name is Nicole Dutra, Senior Project Coordinator at NEHA, and I will be here supporting the webinar today. Quickly, before we begin, I just have a couple housekeeping items to review. First, this webinar is being recorded, and once the link is available, I will be sending that out to everyone. And second, please use the Q&A box if you have any questions throughout the webinar. I wanted to take a moment to review the program scope of work with all of you to provide some clarity, as I've received a few questions. So to date, all participants should have already completed and submitted deliverables for activity number 1 and number 3. If for any reason you have not done so, I sent an email to everyone yesterday as a reminder with all the links. If you do not receive that email, please just reach out to me and I will get that to you. Email is ndutra@neha.org, and I will drop that in the chat shortly. Next, let's look at activity number 2. All participants should have already started or be planning to start very soon the CDC EATS training. The deliverables for activity 2 include 2 items. 1, for you to email your EATS certificate of completion to me, and 2, to complete the evaluation survey to provide your feedback on the EATS training. Next, activity number 4, which is today's webinar. Your deliverable is simply to complete the evaluation survey after the webinar, and you have until April 2nd to complete and submit that. Activity number 5 will be our final webinar scheduled for April 16th, and its deliverable is also an evaluation survey. The final activity, number 6, is not to be completed until all of your other deliverables have been completed and submitted, and it will be due by May 31st. Does anyone have any questions? If you do, please drop them into the Q&A for me, and I will address them. So great. Now I will pass it over to Dr. Laura Brown from CDC. Laura?
Hi, everybody. Welcome back. What I'm going to do is first start with just kind of a reminder of what we talked about last time. It was a little bit jargony, so, and I imagine some of this is new. So I'm going to kind of do a quick recap and then talk a little bit about sort of what the process would look like if you were doing environmental assessments and reporting the data to NERS in your system. So next slide. Okay, so what we talked about last time, sort of the main points of my presentation was that environmental health foodborne outbreak investigators can play a key role in outbreak investigation. They can find the environmental causes of outbreaks, and they can use that information to stop current outbreaks and prevent future ones. So they're an important part of the outbreak investigation process. Next slide. We talked about the fact that environmental health investigators, when they support an outbreak investigation, they are typically focused on identifying the environmental cause of the outbreak, and they can do that by conducting an environmental assessment. And these environmental assessments are designed to describe how the environment contributed to the pathogen reaching the people. How did the agent get to the host? And this can involve a variety of activities. It can involve interviews with staff, observations of food being prepared, review of records, and review of processes and practices used with suspected food items. So next slide. We also talked about how CDC now has the National Environmental Assessment Reporting System, which is a system in which environmental health investigators can report their outbreak investigation data to CDC. We think these data are really valuable because long-term, we think they're going to help us improve outbreak investigation and they're going to help us improve outbreak prevention. So the whole idea of this Explorers series that you guys are participating in is so that you can learn a bit more about environmental assessments, learn a bit more about NERS, learn how other sites are using NERS, and hopefully at some point your site, your health department will be able to incorporate these environmental assessments into your outbreak investigation process. Next slide. Now I do want to make a point here that I don't think I made on the first webinar, and that is that outbreak investigators can do environmental assessments and not participate in NERS. So doing NERS is something that you do in addition to doing environmental assessments. And you can do your environmental assessments. They would involve a variety of activities. If you participate in NERS, there's a couple of additional things that we ask you to do during your outbreak investigation, and then we ask you to report the data to CDC. I think that is something that is commonly confused. So we always try to make it clear that you can do environmental assessments during outbreak investigations. You don't have to report them to NERS, but of course, we would love for you to do so. Next slide. All right, so now I'm going to jump into the process of doing an environmental assessment during an outbreak investigation. And this is, of course, you know, things vary from site to site. So this is just sort of what the overall typical process might look like. So the first step would be to prepare to conduct environmental assessments during outbreak investigations. And we're going to talk a little bit more about each step. So I'm just going to kind of break it up into these three groups here. So you prepare, and then you actually do conduct environmental assessments during your investigations. And then if you're participating in NERS, you would collect some specific data for NERS. And then your third step would be to report environmental assessment data to NERS when the investigation is complete. Sounds simple, right? Next step, next slide, please. Okay, so let's kind of break it down a little bit more. Step one is preparing to conduct environmental assessments. So there's a variety of resources available to you, one of which is EATS, that does provide you some pretty comprehensive training on what environmental assessments might look like and some of the skills you would need to have. There's other resources available, and I've listed them here, and we'll make sure that you get the links to these after this presentation. So, you know, prepare to conduct environmental assessments by reviewing these resources, taking training. And then you would want to communicate and make a plan with your investigation counterparts. And ideally, you're working with lab and epi in your health department to make sure that environmental health is integrated into the investigation process. It would be fantastic if you could shadow experienced investigators. We know that can be challenging. We had sort of a plan in place. We were working on it right when COVID hit. And so that has sort of been halted for now. But if there are investigators that are, you know, within your state, within your site that might be willing to take you out with them, that could be a really valuable experience for you. And then, of course, we have lots of NERS guidance, and we would ask you to review that NERS guidance before you went out into the field. Next slide. Okay, so you're prepared as you can be. Outbreak pops up. So then you can go out and conduct your environmental assessment. And again, sounds simple, but of course it's a process. So ideally you'd go into the establishment when you learn of the outbreak, you conduct these assessment activities for both suspected and confirmed outbreaks. As you're doing this, we ask you to keep track of the number of visits that you make to the establishment, the dates that you do it, keep track of your activities. Of course, you'd consult with epi and lab as needed. They often have data that can really inform your activities in the establishment. And then you would take and complete a couple of NERS parts in the field. So NERS parts 2, 3, and 4, and we'll talk about those in a minute. You would take with you to the establishment to complete at some point in the process. So you do your environmental assessment activities, epi and lab do theirs. And then you need to collect and synthesize information from your investigation. So again, ideally you'd talk with epi and lab. You guys would talk about what you found, you'd review the data, you'd synthesize it, you'd interpret it. And then at this point, you would try to determine contributing factors. So often you have enough data to have a really good sense of what happened to cause the outbreak. Sometimes you don't, but often you do. And then finally, you complete your investigation. In many health departments, there's a report that you have to complete for your jurisdiction. And then you would report data to relevant state and CDC databases. Some states have a specific set of data they want you to report if you're in a local health department. And then, of course, if you're participating in NEARS, we'd want you to report the data to NEARS. Next slide. Okay, so reporting that environmental assessment data to NEARS. NEARS is a comprehensive document. So I'm going to go through and talk about a little bit about what each of those sort of parts of the data collection collect data on. So the part one collects very basic data on the outbreak itself. It helps you describe the outbreak. So the number of locations you visited, the agent, if one was identified, and then specific outbreak ID numbers to help us at CDC match the environmental health data in NEARS to EPI data in our other systems. And then part two is on the outbreak establishment itself. Again, basic information that helps us understand where this outbreak took place. So the establishment type, what type of menu, does the customer have access to food like on a buffet, for example. So this is data that you report basically when your outbreak investigation is fairly complete, and it can come from your consultation with your EPI and lab partners. It can come from reviewing records in your own jurisdiction. It can also come from observations you make when you're in the establishment. Next slide. And then there's some additional things that we ask. If your outbreak has a suspected or confirmed food, we ask you a couple of questions about what that food is. What kind of form does the ingredient come in? How did you identify the food? And again, this data comes from your environmental assessment activities, so record review, observations, interviews. Next slide. If you conducted any environmental sampling for the investigation, we do ask for some data on that. It looks like environmental sampling is something that's pretty useful for investigation. So we're really trying to document what that looks like so we can document how and when it's useful. So we ask some data about the number of samples you took and where you took those samples, and if an agent was identified. And again, that data could come from your environmental assessment activities, conducting the environmental sampling, and then of course from the lab that processed the samples. Next slide. If you identified a contributing factor to the outbreak, we do again ask a couple of questions about that as well. So how did you identify that contributing factor, and when do you think it occurred in the food preparation process? And again, this data comes from consultation with your EPI and lab partners, and then general synthesis of all the information that was collected during the investigation. So that was just it's sort of a general review of what the process would look like if you were doing environmental assessments during your investigations and reporting them to CDC. But again, this is sort of theoretical, or it's sort of the ideal process, right? So that is why we have a couple of sites that actually use NEARS who are going to be here to talk to you today, and they can, you know, talk to you about their real experiences. So I will stop there and see if there's any questions.
If you have any questions for Dr. Brown, please put those into the Q&A option on your screen.
And of course, we'll share this PowerPoint, and we'll share the resources I mentioned with you in a little bit.
Great. Well, thank you, Dr. Brown.
Yeah, thank you.
And next we have our guest speakers who are representing their jurisdictions that are using NEARS, and they are going to share some of their experience with you. Matt Payne from the Connecticut Department of Public Health is going to speak to you first. So Matt, I will stop sharing and you can go ahead and share your screen. Perfect. Thank you.
Just making sure I unmuted.
You're
All
all
right.
set.
Well, thank you for having me. Great opportunity, especially for people who are looking to get into this, and for me to have a chance to give back, because the NEARS tool has been very helpful for me, especially with transitioning from working at our local health departments to the state level. So first and foremost, I'm going to just talk briefly about our public health structure here in Connecticut, our history with NEARS, the benefits that we have had from using it, what it retouching on those components of what NEARS consists of, some tips and tricks, onboarding that we do with our with our hires, which included me as well, and then a reminder of my email address for anyone who has a question, wants to reach out, as well as for you to put questions into the chat for us to discuss after. So Connecticut's not a very big state. However, we have 169 towns that are covered by 59 different health departments or districts. On this map, you see that there are some full-time health departments that cover a single town, which are the yellow. The blue are health districts, meaning one entity that covers multiple towns. We have a few part-time director municipality levels. And then we also have two sovereign nations with our two tribes. And our total population is just over 3.6 million. So quite a bit there in a state our size. At DPH, our team consists of us with food protection, our EPIs, and also with our lab. And our EPIs are very involved with routine surveillance of reportable diseases, and we meet with them pretty regularly. We actually sit not that far away. We often feel like prairie dogs because we'll stand up and look over the cubicle walls at each other if there's something going that comes across that catches our eye. And then our lab is a very great resource that we could not investigate without them. So always want to shout out to the players that help and acknowledge their contributions. So in Connecticut, our local health departments, the districts or the single municipalities, they handle the permitting and licensing, the inspections and the complaints that come through. We still get a handful of questions from either prospective establishments or the public when they want to file a complaint or questions about an inspection. And we often will refer those over to our local health partners as they have the jurisdiction. They also do a lot of other things in the world of environmental health, not just food. And where we come into the picture is we are really doing a lot of work with our standardization of new food inspectors across the state, our work to for recertification of the current workforce, training and subject matter experts for food code related matters and variance approvals, on top of assisting with the outbreak investigation. So that's kind of Connecticut in a nutshell. So the text you're seeing here is actually from the earlier version of NEARS, which was called NAVIS. That we enrolled in 2014, but that later changed to become 2016. And if I bring up this, you'll see that is the NEARS language. So you'll see they're pretty similar between now and then with a couple of modifications. So just wanted to highlight that before NEARS was NEARS, the the benefits and the way to do it were similar. And there is a lot of work being done on updating the tool. Has been very helpful. And prior to 2014, Connecticut was participating in the Environmental Health Specialist Network, or SNET. Food protection would assist local health staff with interviews with food workers, reviewing menu items and data collection of samples. We would come out and assist. At the time, I was actually working at local health departments, so I worked with my state counterparts during an outbreak. And then before February, we were using our own regulations in Connecticut. We hadn't adopted a recent version of the food code. Ours was quite an older version. And in February of last year, we actually adopted the FDA food code. So by getting involved with NEARS, it allowed us to collect data and contribute it to the larger picture of understanding outbreaks, the cost, the cause, all of those things. It allowed us to be involved in these studies, even though we were using a different code that had a different markup, and there was no easy way to share that data to compare it. So this really played a picture in that. And by participating in NEVIS or NEARS, our investigation process more aligned with other states and allowed us to contribute that data to those larger studies. It's more structured, and staff get access to some immediate training and can hit the ground running faster. When I first started in 2019, I wasn't here long before I had to go out with a colleague to see what a NEARS visit was. And I may have just started the EATS training a few days earlier, but really got into it very quickly. And I found, especially to the point Dr. Brown mentioned earlier about going out with a more experienced user, that was very helpful for me. And I can't stress that one enough if you have someone, and reviewing an old one too. If you can't get out with someone and you have the form from a previous one, reviewing that will help you kind of understand what you're looking at and just taking the time to prepare. So it is very structured and it's easy to implement. Again, I went out once with a person and did the training, and then I went out there and did it myself. I wasn't alone. I could reach out and get help. If I called in and had a question, there was a team member available to help me. And it promotes assessing the food safety culture of the food establishments during the environmental assessment. So, and we do that through interviewing management about their practices and policies, and then actually observing their food handling practices to ensure that the focus is on the big picture. If they have a practice or policy, are they actually doing it? Or are they telling you what they think you want to hear, which, as many of you may know, you may have had that experience before. It helps us identify the contributing factors, which is the how, and learn the environmental antecedents, which really answers the why. So contributing factors, they fall into the three categories of contamination, proliferation, and survival. And I mean, this really explains, how did the food item get the pathogen? How was it able to proliferate, and how was it able to survive? Some things may not have a survival depending on what it is that you're looking at, virus versus a bacteria. So it's important to understand that before you kind of go out what these are. And then when it comes to the environmental antecedents, these are the internal system variables in that middle circle there of the equipment, the processes, the foods, the people, and the economics. So what you're seeing here is probably not new to anybody, but I'll just highlight it again. And this really talks about, well, why did the person work while they were ill? Was there a monetary reason because they didn't have paid sick leave? Was the equipment broken because it hadn't been properly tagged for repair? There's many factors when doing this outbreak, and by keeping these things in mind, it helps you keep your focus on what happened and why, and identifying how to prevent it from happening in the future. Environmental assessments. So NEARS is made up of 7 parts that was highlighted already, and some may not come into play depending on the scope of your outbreak. If you are unable to get a food sample or unable to do some environmental sampling, you might not touch parts 5 or part 6. Depends on the situation, and that's okay. Understanding that sometimes if you're coming in really late, the odds of some food items may not be there. But during these visits, we're looking to see if they're actually following those practices they told you, those interim measures that may have already been put into place. So if a establishment's dealing with norovirus and they were told to switch to a chlorine sanitizer, did they actually do that? Do they have one on site? Do they have the proper equipment for cleaning up after a bodily fluid if they're dealing with that? There's a couple of things that this really can help us point there. The interview is a very helpful tool. I would recommend a little bit of practice before you do it, because there is a prompt that you are supposed to read, and we don't want to skew their answer to give you to get that bias. So we definitely want to be a little bit prepared on that. And then the observational part, the form is very guided and talks and focuses you on the hand sinks, how many they have, are they properly equipped? And really, this is to make sure that we are looking at the full picture, and that will help us determine, well, why weren't they washing their hands? Well, it turns out there was only one hand sink and it wasn't accessible because it was piled up with equipment. That would give us that guidance and give local health, in our case, the potential to issue an order to the establishment to install possibly a new hand sink. Make sure that they have the adequate supplies more often, and identify areas for future follow-up, both short-term and long-term. So some tips and tricks. So know your team and your stakeholders. Communication is key. We've talked about in many circles the three-legged stool approach of an outbreak. And some things we enter in NEARS are also reported in the NORS system, which is what our EPI program participates in. So it's good that we, in our case, we often will meet with our EPI partners, usually around this time of year while we're all entering into our systems, to make sure that the detail, the contributing factor, matches up between the two systems. And I know there's been some upgrades going on to link those up, which has been helpful. There's also the virtual and online training. You talked about EATS 101. Hoping sometime soon EATS 102 will be back. That was a good one as well. And shadowing another individual. Final part of this, though, is also having a standardized data entry and collection system, which is what NEARS really helps with. It really provides that standardized approach. And with us, Connecticut not being a super large state, we can drive from one side to the other in roughly an hour and a half, and we're all pretty centrally located. Having us able to get out there and do it and getting it into the system ensures that there's some uniformity in how it's entered. So if you're a larger state, it's just something you want to have on your radar of, well, are we going to need more than one site administrator because our state is so large, or is there going to be an on-call system where you discuss it with each other to make sure you're covering it? In other areas, this may, depends on your state and the options and structure you have. So you guys know that the best, and how you're working and getting those players to the table so that way you can cover that. So onboarding for new team members, this was done previously with me when I joined, and recently we did it with our newest person, who is actually someone who came back. But new staff complete the EATS 101 training, review an old outbreak, and they look at the NEARS form, and we have them walk through it. We talk about it before we're on our way out. When we have an outbreak and we're doing a NEARS visit, we'll have the new person go out with a seasoned person. Often we'll hand the clipboard to with the last one, I gave him the clipboard, had him start to fill out the form, and then looked it over just to make sure we're in a good place, because that hands-on experience is really going to help them with learning how to do it. The experienced individual conducts the visit, but the new person is filling out the form as instructed. That we tell them ask a question if it's not clear. This is really a chance for them to really get a taste of it, but also feel like that they're not on their own, and they can draw off those experiences. And then when entering the data from the paper and the forms into the system, we'll do a quick tutorial. We'll just show them that it's literally, most of the cases, it's just taking the stuff right off the paper form and entering it into the electronic system. And that's one thing we definitely continue to work on, is trying to get that in there. I would recommend, as a additional tip or trick, getting that stuff into NEARS as soon as possible, because being a couple months later and trying to enter it in can sometimes take a little longer than when it's fresh in your mind. And with that, there's my email address. So any questions that you think of afterwards that you want to send, feel free to do that. Pretty quick with responding to emails, and I know that we're going to have a question and answer afterwards, but that's my contact info.
Great. Thank you so much, Matt. Appreciate your contribution today. And next we have Thao Schlichte from Iowa Department of Inspections, Appeals, and Licensing. So Thao, go ahead and share your slides, and I'll let you know when they are up. Perfect. Great. Thank you, Thao.
Good afternoon, everybody. I am Thao Schlichte, and I work at the Iowa Department of Inspection, Appeals, and Licensing, also known as DIAL. A little bit about myself. I was actually a food inspector for 9 years before I took this role as the Rapid Response Team Coordinator, and I actually did conduct environmental assessments during outbreak investigation. So I'm going to start off and talk a little bit about Iowa. Our population size is a little over 3 million. My agency, DIAL, conducts all food safety inspections and complaints in Iowa. So on that map, you'll see that there's colors. We oversee the white portion of the state. So that's 63 out of the 99 counties that we regulate with 22 food safety specialists. And then we also contract out to 12 local health departments, and they oversee the remaining 36 counties with 41 environmental health specialists. So I wanted to go over a little bit about the different types of licenses that we offer. You'll see that on the right side in that chart, we use a single statewide database for licensing and inspection. We have over 21,000 establishments that are active licenses. My agency oversees just shy of 12,000 establishments. The remaining establishments are overseen by our contracts. And then another interesting fact is that last year we issued 4,000 temporary food licenses for farmers markets or temporary events. Those are not active. They deactivate after the event is completed. In 2023, we investigated 36 Iowa outbreaks, and we're a part of 5 multi-state outbreaks. So I just want to go over the 3 core partners that are part of our outbreak investigation structure. The first column, we have our Iowa Health and Human Services. That's our local public health, along with the state. The middle column, we have our environmental health. So that's where my agency falls in with our local contract agencies. And then also our Iowa Department of Agriculture and Land Stewardship. They're separate. Ag is separate from my agency. So, and then on the third column, we have our state hygienic lab. So the public health, they will be intaking the complaints, reviewing any of the food history, taking clinical samples. And then with environmental health, we will be the ones that are going to be conducting the risk-based inspections, performing environmental assessments, and conducting any environmental or food sampling. Our lab is going to be testing all the samples that are collected and confirming any diagnosis, entering into PulseNet. And then just a little bit more about Iowa. We have a rapid response team, and what that means is it's a multi-agency team that involves interagency collaboration, communication to respond to any type of food emergency, incident response. And that's really where my main role in the agency is, to help coordinate our team. We often activate an ICS or incident command system structure, which is just a standardized way to organize ourselves during any type of emergency response. But we often meet, we do a lot of training, but I just have to throw that plug in there for our RT program. So I'm going to go back to when we receive an outbreak that is received by our public health or our local public health. They will interview the complainants, and that information is forwarded on to our foodborne epidemiologists, who will evaluate that information and determine if there are any common food establishments, and that will be reported to my agency at DIAL. So my role is to assign that to a regulatory inspector along with our environmental assessment team lead to conduct that investigation. Now, if it's in one of our local contract agency territories, we will work with their regulatory inspector, but also assign one of our environmental assessment team leads to go along with them. So just a little difference between when we're part of multi-state and a single state within just our state of Iowa. When you're in multi-state, you're going to be working with many federal partners, CDC, FDA, maybe even USDA. But when it's within Iowa, we are going to always assign it 2 inspectors minimum with our environmental assessment team lead. We actually have 5 dedicated inspectors that are part of our assessment team, and that means they cover all 99 counties. So if we receive an outbreak, we're going to send one of the 5 to wherever that outbreak implicated facility is at. The regulatory inspector is going to be doing a routine or illness complaint inspection, and then our team lead will be conducting that environmental assessment. I like to just throw this slide in there because I always feel like anytime we have some type of outbreak, emergency response incident, I'm in that middle portion of the diagram and trying to figure out, do we need our environmental assessment team? Do any of our federal partners need to be made aware for any type of situational awareness, or do they need to be a part of the outbreak? And there's, because we activate the incident command system for a larger outbreak, what positions need to be filled in that as well. So it's just a lot of coordination and information gathering and communication, collaboration. So how do we do that? We really rely on our environmental assessment team. And so I want to go into our field response. What you'll see on this page on the right side is actually the first page of environmental assessment. And as I mentioned, when we start our environmental assessment investigation, we always want to do a routine complaint inspection with the assigned inspector. And then we have our team lead that's going to be doing the assessment. And, they want to determine what happened, what could have caused that illness, what was the cause. And we look at a variety of factors: the host, food, water, the people, social environment. We do a lot of training with our environmental assessment team, as Matt and Dr. Brown mentioned, CDC environmental assessment training series, EATS 101, and then someday 101 and 102 when it's available. We do a lot of job shadowing, monthly meetings, a lot of different trainings with chain of custody when we do sampling, trace back. And then we practice a lot using a variety of activities, online training, tabletop activities, and then real life coordinated events. This is just, I know it's hard to read, but it's just a slide that kind of overviews our checklist process that we have our staff who is actually doing the environmental assessment go out. A lot goes into, preparing before they conduct an assessment. For example, we want them to review the history, potential risk factors. If we do have a suspected pathogen, we want to look at potential contributing factors. We have them prepare for potential language barriers. So a lot of pre-prep, but when we're actually on site, and then following up with the operator, reviewing the inspection report and doing the exit interview. And then even after ongoing response, not every outbreak is done in a week. It can be ongoing, and we may be visiting the facility more than once, conducting more than one environmental assessment as we learn more information and as we receive more complaints. So what actually happens during the environmental assessment? I know Dr. Brown covered this already, but a lot of record reviews, reviewing the facility's standard operating procedures, any record collection we may need for a trace back, trace forward, receipt. We interview the manager, the food workers that were present during the outbreak, and then we review production, any places that they store and receive products. We conduct food flows. What I mean by food flows, we actually have our staff create food flow diagrams of implicated foods if we know what they are from receipt to when it lands at the consumer's meal. And then we focus on contributing factors. I know Matt mentioned this before, but to get into more specifics, we just look at employee health. How are they storing their food with temperature, cold and hot holding, cooking and cooling methods. We look at cross-contamination, personal hygiene, and bare hand contact. Another great thing about NEARS, Iowa did not create this, so I don't want to take credit for it. It's actually a resource provided from one of the other NEARS users. If you're a part of the NEARS work group, they will post amazing resources, and these are one of the ones that were posted that we adopted in Iowa. So you can see on the left side, it lists a suspect, agent, or pathogen of concern. If we do know that, this is a guide that our staff uses. So for example, on the top left, you see norovirus, and in the field focus, we want them to focus on bare hand contact, hand washing, and the ill food worker. And then look at potential interventions, control measures. So this is just a great resource that our staff is currently using, and we would not have had this resource if we were not a part of NEARS. So that's another benefit of being a part of this and being part of NEARS. So ultimately, we want to determine the environmental antecedent, so why the outbreak occurred, any potential contributing factors, how they occurred, and really it helps us determine what happened. So what happens to our environmental assessment? If they meet the criteria, we do enter them into the NEARS surveillance system. It ultimately helps our staff determine common food vehicles and monitor any trends. It helps us identify the common contributing factors and environmental antecedents that we're observing during outbreaks. And that helps us during routine inspections. We want to focus and train and educate our operators. So what are we seeing in Iowa? What are the common contributing factors that we are seeing that we should be focusing on and training them on to prevent future outbreaks? It helps us generate hypotheses for our outbreak, helps us work with food facilities to help improve their food safety program. So why do we conduct environmental assessments and the lessons that we've learned in Iowa? I've heard Matt already talked about this. It helped standardize our procedure, and that is definitely what it did for Iowa. It helped us have one voice when we're out doing an outbreak investigation. When you're in the facility, it's chaotic at times when you're having multiple management, the owner, you have your inspection staff, and then your environmental assessment team lead. It can be really stressful. So this helps drive our focus in the investigation to help coordinate when we're in the facility, and it helps us identify the questions and who we need to speak to during an outbreak. And it helps us provide consistent and clear data. And because of environmental assessments, we determined we needed a dedicated team. So we continue to focus on continuous education and getting them and training opportunities. And also really helped us define our roles and responsibilities. A lot of times I hear from previous outbreaks, there was a need to identify the different roles. And that's part of why we also stand up the incident command structure. It can be confusing, not knowing what you should be doing during an outbreak. And so by having this environmental assessment team in place, having our rapid response team and ICS structure, it really helped improve our communication and collaboration during all of our responses. Ultimately, this has given us a systemic approach to identify our contributing factors and environmental antecedents. And I just wanted to really highlight a really quick outbreak that we worked in 2022 linked to cantaloupe melon. My role was to help facilitate this response. There were over 50 people involved in this response in my agency, Dial, but also with our local contract agency. 39 individuals were identified ill and interviewed by our local public health and our state public health. We attempted to collect traceback records at 38 different operators. We tested 54 melon. And the biggest thing about this response is it would not have been successful if we didn't have our environmental assessment team leading the sampling, conducting the traceback, and working with all the vendors and communicating with all our federal, local partners. And this ultimately was why we had a successful response. Thank you. So any questions?
Thank you, Thao. Great presentation. All right, if anyone has any questions for Matt or Thao, please post them into the Q&A option, please. Or I know Matt shared his email, or Matt, would you like to, or Matt and Thao, if you wouldn't mind dropping your emails into the chat, if anybody wants to reach out and ask you any questions offline. All right, great. I'm going to pull up my screen. All right, thank you, Matt and Thao, for your presentations. Great insight to the experience you've had with NEARS. We appreciate that. So I will thank everyone for attending today's webinar number 2 for CDC NEARS. The QR code there on your screen is to the evaluation, which is due April 2nd or by April 2nd for today's webinar. If you have any questions, please reach out. Otherwise, everyone, we are giving you 13 minutes back to your day. Have a wonderful rest of your day, and we will see you next time. Thank you,
Thank you all.
everyone.